Congratulations on your new arrival. This short video will give you some useful information about the postnatal period which you need to be aware of. You will also be given a postnatal pack which provides detailed information and will be a useful resource for you to keep handy whilst at home.
Leaving hospital. We run a 24-hour service and aim to get you home when you are fit for discharge. We ask for your patience if there is a delay. The midwife will usually discuss your plans for discharge and ensure that you are in full health and all tests and checks are completed and the results are given to you to ensure that you are kept fully informed. The midwife will give you your postnatal information and the postnatal information pack, which will include contact numbers of who to call if you should need help or support.
You will also be given a personal child health record for your baby. This may be a book or an electronic copy.
If you have a hard copy in the form of a book, you must bring it to any appointments that you attend with your baby, such as midwife, GP, or health visitor appointments. If you have an electronic version, you do not need a hard copy.
Please make sure you have all your current paperwork with you before you leave the hospital and that you've updated the staff with your current discharge address and contact numbers.
If going home by car, we strongly advise you to use a well-fitting car seat for your baby and to have read the manufacturer's installation instructions before fitting the car seat.
All babies will need to have a full newborn examination known as Nappy within 72 hours of birth.
This will be undertaken by a paediatrician or midwife who is advanced training. A health professional will usually check your baby's eyes, heart, hips, and for baby boys, testicles. Hearing test. Your baby will have a hearing test soon after birth. If you have your baby in hospital, this may happen before you leave. Otherwise, it will be done sometime in the first few weeks in your home, at an outpatient clinic or at your local health centre. You will receive a letter through the post for this.
If the results after the first screen aren't clear, don't be overly worried. This is very common and can be from fluid after the birth.
If the results from the second screening test remain unclear, your baby will be referred to audiology for diagnostic testing. Community midwives.
The midwife will usually visit you at home the day after you leave hospital and will discuss future visits according to your specific needs. If you have had a home birth, the midwife will discuss future visits before they leave your home.
This care will continue for at least 10 days and up to 28 days in some cases. When visits by your midwife are no longer necessary, your care will be transferred to the health visitor and GP, who will continue to provide support as your baby grows and develops until your child goes to school. If the midwife does not visit the day after discharge, please use the telephone numbers provided to you on discharge to contact the hospital. Please call before 12 o'clock midday using the numbers provided to arrange a visit. Where possible, this will be the same day. However, you will be able to seek advice from the midwives either in the triage service or the postnatal wards. Day 5 screening. When your baby is 5 days old, a healthcare professional will offer to perform the newborn blood spot test.
This will be done by a healthcare professional who will prick your baby's heel and collect 4 drops of blood on a special card.
You can ease any distress for your baby by cuddling and feeding them and making sure they're warm and comfortable. If your healthcare professional has not attended or made an arrangement with you to perform this important screening test, please contact the hospital on the numbers provided to arrange this. The blood test will test for sickle cell disease, cystic fibrosis, congenital hypothyroidism, inherited metabolic diseases, and severe combined immunodeficiency. Further information about these important screening tests can be found at www.gov.uk/guidance/newborn. The healthcare professional will also offer to weigh your baby to monitor growth and provide support. Specialist feeding support is available and your healthcare professional will talk to you about a referral if required. GP follow-up. So you can be sure your body is recovering after having your baby and that your baby is thriving, you should arrange to have a 6-week postnatal check with your GP. You will need to make the appointment yourself. If you have not had a cervical smear in the last 3 years, it is a good idea to have one no sooner than 3 months after you have had your baby. You will need to organise this with your GP or practice nurse. Your baby will also need to have an appointment at 6 to 8 weeks to check they are well. You will need to make this appointment with your GP. Pain relief.
It is normal to feel muscular aches and discomfort following birth. If you are feeling uncomfortable, you can take over-the-counter medication such as ibuprofen and paracetamol,
Following the instructions on the packaging as you would normally. If you were prescribed specific pain relief by your healthcare professionals, please ensure you take these as directed. If you need further pain relief, please speak to your midwife, health visitor, or GP. Common illnesses. Many people may suffer from tension headaches and/or migraines after the birth. These usually resolve with mild pain relief such as paracetamol and rest. Relaxation exercises may also help to get rid of tension.
If, however, you have a sudden onset severe headache with neck stiffness and a high temperature, you should contact your midwife or GP straight away.
If the severe headache occurs within 3 days of the birth and is accompanied with heartburn type pain, blurred vision and flashing lights, nausea or vomiting, you should also contact your carers, as this may indicate a sudden rise in blood pressure which may require treatment.
If you had an epidural and then develop a headache which worsens when upright and relieves when lying down, this could be symptomatic of an epidural complication and should be reported to your midwife.
Please also look out for fever, raised temperature, shivering, abdominal pain or offensive smelling discharge, as these are signs of infection. Infection markers can also include palpitations, dizziness, rapid pulse, weakness, sweating or restlessness.
If you have any signs of a urine infection which include burning, stinging or needing to go more frequently, it is very important you contact your GP or maternity triage.
It is normal to have some ankle or foot swelling for a short time after giving birth. This is from extra circulating fluid in the body. Elevating your legs when you are sitting down or placing a pillow under your legs when you are sleeping may help to reduce swelling. Red, painful area on the breast.
You may experience red, painful areas on the breast. This is most commonly seen when chest feeding. This can fall into 2 categories:
Infective and non-infective mastitis. Symptoms are similar for both, are high temperature and flu-like symptoms. Non-infective mastitis is usually caused by blocked milk ducts and is managed by wearing a well-fitting bra and ensuring your baby is correctly positioned at the breast. Infective mastitis is a bacterial infection, usually caused by a cracked nipple, and will require referral to your GP, as treatment is often with antibiotics. Neither is a reason to give up breastfeeding, and your midwife will show you how to ease the symptoms by massaging the breast, taking paracetamol, increasing fluids, and resting.
Over the next few weeks, you will continue to lose blood. It is normal to have a short gush of blood that stops quickly, especially if you have been lying down for a while or have been feeding your baby.
This is normal following childbirth, as your womb returns to its normal size. The blood loss will initially be heavy and bright red. Over time, this will change to a more watery consistency and then change to pink and then brown.
Occasionally, the blood loss will remain heavier than usual, become brighter, fresher, or smell offensive. You may pass some blood clots.
If they are bigger than a 2p coin, please make a note of this and report it to your midwife or the triage department. If you are concerned that you are soaking through pads, please contact your maternity unit. Should you find that you are experiencing any of the above, please contact your doctor or midwife as soon as you can.
If you have swelling in your calves, shortness of breath or chest pain, this could be a warning sign that you have developed a blood clot in your leg. If you have been prescribed blood thinning medication, it's important that you complete the course.
If you experience any of these signs or symptoms, please contact the hospital on the numbers provided. In some circumstances, you may be directed to your local A&E department. You will be taught how to administer the injections before you leave the hospital. Perineal care.
The perineum is the area of skin between the anus and vagina front opening. It is important to keep this area clean, especially after you have had a baby.
Daily showers are very important, particularly if you have had a tear or stitches, and the perineal area should be gently dried with a clean towel. You should ensure you change your sanitary pads frequently, and it is extremely important to wash your hands before and after changing your pads or going to the toilet to avoid infection. If you notice any breakdown of your stitches, foul odour or excess ooze coming from the area, then please call the maternity triage for assessment in case of infection. Stitches are dissolvable and will not need to be removed. Wound care.
If you have sustained a tear or had an operative procedure during birth, keep the area clean. Have a shower at least once a day and change your sanitary pads regularly.
Following a caesarean section, you will have a dressing covering your wound. Some dressings stay on for approximately 5 days, and other dressings stay on for between 7 to 10 days. Your midwife will explain this during your stay in hospital.
Your wound dressing will be removed by a healthcare professional either at home or at hospital at the appropriate time.
Occasionally, you may notice a small area of oozing on the dressing. This often appears in the first 2 hours from the operation, so please don't be alarmed. However, if you notice this ooze enlarging or breaching the seal of the dressing, then call maternity triage for advice. Once the dressing is removed, your skin should be almost healed and intact. Please keep the area clean and dry. If you notice any oozing, bleeding, discharge, redness or opening of the wound, then please call the hospital, as it may need to be reviewed in case of infection.
We predominantly use dissolvable sutures which disappear as the wound heals.
Occasionally, other products are used to close the caesarean wound, such as staples. You will be informed of this, and a personalised plan will be made so that your healthcare professional knows the instructions for removal if required. You are advised that even if your skin appears healed, you are still healing internally, and for this reason, it is not recommended that you drive for approximately 6 weeks.
You will need to contact your insurance company to check the specific details of your cover. You do not need to contact the DVLA.
Recovery following childbirth.
To aid with recovery following delivery, it is important to take good care of yourself. With a new baby, it can be difficult finding the energy to cook or eat properly.
A healthy, balanced diet usually means eating plenty of bread, breakfast cereals, potatoes, pasta and rice to give you energy, as well as fruit and vegetables. Lean meat, chicken, fish, eggs and pulses are good sources of protein. Dairy foods such as milk, cheese and yogurt contain calcium as well as protein. If you are breast or chest feeding, make sure you eat and drink plenty and avoid caffeine, alcohol and going on a weight-reducing diet. Small, regular meals will keep up your energy levels without adding to your weight.
It is also important that you are a healthy weight for your height before you get pregnant again.
If you have concerns about your weight, contact your GP. Drink enough to remain well hydrated, especially in warmer weather.
This will ensure that your bowels open regularly and prevent you from becoming constipated.
Do pelvic floor exercises as soon as you can after birth.
This will increase the circulation of blood to the area and aid the healing process.
Pelvic floor exercises. Postnatal exercises are very important and should be tailored to your individual needs dependent on the type of birth you have had. They include abdominal, leg and breathing exercises, as well as relaxation techniques. Having a baby changes your body, but you can help yourself by doing pelvic floor exercises. This can support you to strengthen the muscles around the bladder, genitals and anus. This will aid your bladder control and improve or stop leakage of urine. To do your pelvic floor exercises first, get into a comfortable position. Any position will do. Imagine that you are trying to stop yourself from passing wind and at the same time trying to stop the flow of urine. The feeling is one of squeeze and lift, closing and drawing up the back and front passages. This is called a pelvic floor contraction. Remember, you should start gently and stop if it hurts. Do not pull in your stomach excessively. Squeeze your legs together, tighten your buttocks or hold your breath. You will be provided with information on routine postnatal exercises before you go home.
Some people will additionally be referred to the obstetric physiotherapy team following their birth. They will visit you before you go home on the postnatal ward.
They will provide information and advice depending on your individual needs. In some instances, the physio will recommend that you wait 6 weeks to begin pelvic floor exercises. Contraception.
Contraception may be the last thing on your mind when you've just had a baby, but it is something you need to think about if you want to avoid or delay another pregnancy. Did you know you can get pregnant as early as 3 weeks after just having a baby? There are many options for contraception, some of which can be provided before you leave hospital.
There may be specific recommendations about how long you may need to wait to allow adequate healing to take place before resuming sexual activities. This is routinely a matter of personal preference. However, there are some circumstances where you may be advised to seek additional advice, access preconception care, or allow additional time for internal healing. Emotional well-being.
It is common to experience an assortment of feelings in the first few days after having a baby. Adjusting to a new baby can leave parents feeling drained, especially within the first few months.
Emotions can range from extreme happiness to mood swings of anxiety, exhaustion, and tearfulness. These feelings are often part of the baby blues, which affect around 50 to 80% of those that have had a baby. It is not known why the blues occur, but they are very common and can occur any time within the first 10 days after birth. These feelings are usually short-lived, and most people describe feeling more like themselves within a few hours or days. Sometimes you may experience severe mood changes, often described as postnatal depression. Characteristics may include feeling low most days, lack of interest or pleasure in normal activities, loss of appetite, difficulty sleeping, tearfulness, irritability, anxiety.
This list is not exhaustive. If you think you may be suffering from postnatal depression or experiencing any of the symptoms, please seek advice from your GP, midwife, or health visitor.
What are the signs of a healthy baby? Regular feeding, wet and dirty nappies, normal coloured skin for your baby, warm, not too hot or too cold to touch, and regular breathing. What should you look out for? Your baby being very sleepy or floppy, not waking spontaneously for feeds, not feeding well. A persistent high-pitched cry, persistent cry that does not resolve when held or fed, fast breathing or a change in breathing pattern, a rash that does not fade, abnormal skin coloration, for example, mottling, blue. The umbilical cord. The umbilical cord is the baby's lifeline during pregnancy, but is no longer needed when the baby is born. Within a few minutes after birth, the cord is clamped and cut close to the navel. Once deprived of its blood supply, the cord will start to dry out, harden and turn into your baby's belly button. The cord has no nerves and therefore your baby will not feel any discomfort while this is happening. Care of the umbilical cord. Wash your hands before and after all baby care. Fold the nappy down under the cord to encourage the cord to dry out and prevent contamination by urine and faeces. Try not to touch the cord as this will reduce the risk of cross-infection. Avoid tight-fitting clothes to encourage air circulation around the cord. The clamp may be left on as the weight of it will encourage separation. You can give your baby a shallow bath using just plain water. Only clean the cord if it has been contaminated with urine or faeces. Use plain water to do this. Submerging the cord in water can delay the separation and weakening of the cord falling off. Separation of the cord. Cord separation usually occurs between 5 to 15 days. This may be delayed if your baby has received antibiotics or if the area has become infected. During separation, small amounts of a sticky discharge may be at the junction of the cord and the skin. This is normal. After the cord has separated, there may still be a small amount of sticky discharge for a few days. Again, this is normal. Continue to keep the nappy under the cord until it is completely dry. Signs of infection. Redness around the belly button area, swelling and tenderness at the site, any bleeding. Any yellow, green discharge and/or an unpleasant smell. Your baby may not feed well and become lethargic and have a raised temperature.
If you notice any of these symptoms, please tell your midwife, neonatal nurse, health visitor or GP at once, as your baby might need antibiotic medicine.
Jaundice.
Jaundice in newborn babies is usually common and harmless. It causes yellowing of the skin and the whites of the eyes. The medical term for jaundice is neonatal jaundice.
Yellowing of the skin can be more difficult to see in brown or black skin. It might be easier to see on the palms of the hands or the soles of the feet or the white parts of the eyes. Other symptoms of newborn jaundice can include dark yellow urine, pale coloured faeces, it should be yellow or orange. The symptoms of newborn jaundice usually develops 2 days after the birth and tend to get better without treatment by the time the baby is about 2 weeks old.
While jaundice is not usually a cause of concern, it is important to determine whether your baby needs treatment.
If your baby's jaundice appears to be worsening and alongside this, the baby is lethargic, sleepy, difficult to feed or has less appetite, or you are concerned about the urine and stool output, let us know by calling the numbers provided by your hospital for advice. It may be necessary for your baby to be seen by a paediatrician, or the hospital may send a midwife to you to review at home. What is in a nappy? Signs that your baby is feeding well includes day 1 to 2, 1 or more wet, dirty nappies. Days 3 to 4, 3 to 4 or more wet and 2 or more dirty nappies. Day 6 onwards, 6 or more wet and 2 or more dirty nappies.
For the first couple of days after birth, your baby will pass meconium. Meconium is a black, sticky, tar-like substance with no odour. Its appearance is a good sign that your baby's bowels are working properly.
After a day or two, as feeding is established and the last of the meconium passes out, the faeces will turn a brown-green colour. Stools will be looser and have a grainy texture. After about 3 days, your baby's faeces will gradually change to a mustard yellow colour. It is not unusual for breast or chest-fed babies to have several mustard-coloured, loosely formed or even watery stools a day, sometimes after each feed. If you notice any inconsistencies or problem with your baby's bowel movements like constipation, hard stools, or diarrhoea, watery stools, speak to your midwife, health visitor, or GP for advice.
Your baby will normally pass urine. Your baby's urine should be pale and not dark brown in colour. Urates may be present within the first couple of days.
Urates are a dark pink-red substance which can be normal to excrete. However, if the passing of urates go beyond the first couple of days, talk to your midwife, as it can be a sign that your baby is not getting enough milk. Feeding.
Health professionals are responsible for ensuring you have evidence-based information with which to make your feeding choices. They will support you in your feeding choices no matter what they are. At each visit, your health professional will ask how your feeding is going.
This is a perfect opportunity to allow them to watch a feed or ask them any feeding-related questions you may have. Healthcare professionals can perform a feeding assessment at every contact and offer help and support. Relationship building and responsive parenting.
When your baby is born, those early days and weeks are the most important in shaping your baby's brain and helping the transition from womb to world. The 4th trimester refers to the period immediately after birth and up to 12 weeks of age. It is a crucial stage of development for your baby as it adapts to its new environment.
When in the womb, your baby had a 24-hour cuddle, could hear the constant beating of your heart, the swooshing of your placenta, never ever felt hungry or thirsty or cold. Any noises they heard were muffled sounds as baby was in an aquatic environment, and any lights your baby saw were a dim red glow. Baby won't settle, and we don't understand why.
Baby won't settle? Well, here's why. Babies don't understand they've been separated from us for the first 12 weeks of life.
Baby can't hear your heartbeat. Baby is now able to feel the cold. That 24-hour cuddle has disappeared. Baby is smelling things for the very first time. The noises are loud. The lights are bright. Baby is now experiencing hunger and thirst as your placenta isn't providing for them anymore. And that cot is hard and cold, not squidgy like in the womb.
So, how do we make baby feel calm, safe and reassured? We need to recreate the experience they had in the womb. And the best way to achieve this is to keep them skin to skin.
Why? Well, when in skin to skin, baby can hear your heartbeat. They are getting that cuddle. Against your skin will help regulate baby's temperature, breathing, heart rate, circulation, blood sugars, and trigger those ever-important release of hormones, oxytocin and prolactin, reducing those stress hormones for both you and for baby.
Skin to skin is going to trigger the baby's natural reflexes to want to feed. And as we rock our baby, it will be just like it was back in that aquatic environment. And as we shh our baby, it will replicate the placental sounds.
Skin to skin happens following birth and after this at every opportunity, when we need comfort, when baby needs comfort, soothing, calming, when we are getting ready to feed, and for any reason at all.
Understanding normal neonatal behaviour is very important as babies have the need to be close to you and we need to be responsive to our baby's needs.
During the early days, babies may want to feed a lot as they feed for nutrition, comfort and protection. Being responsive to your baby helps to build their brains, helping them to feel safe and secure when they are close to you, as both you and baby release the bonding and nurturing hormones, oxytocin and prolactin. Prolactin triggers the natural parenting instincts, and when you're breast or chest feeding, it's your milk-making hormone.
Responsive parenting means cuddling your baby and not leaving them to cry. Don't worry about getting your baby into a routine.
Understanding you cannot spoil your baby. Their brains have not developed enough to be able to manipulate you or the situation. Responsive parenting is also about feeding our babies when they signal their feeding cues. As well as skin-to-skin contact, you can look into baby's eyes, sing to baby, read books, cuddle your baby, pick them up when they're crying, as it all aids brain development.
While sudden infant deaths are rare, it can happen and is tragic if it does occur. The Lullaby Trust provides expert advice on safer sleep for babies. You can access information on their website and YouTube.
The safest way for your baby to sleep is on their back and feet to the foot of the cot. It's lovely to have your baby with you for a cuddle or a feed, but it's safest to put your baby back in their cot before you go to sleep.
At home, it is now recommended that babies sleep in a cot in your room until at least 6 months. It is also now advised that your baby should sleep in the same room you were in during the day.
Do not share a bed with your baby if you or your partner smoke, have recently drunk any alcohol, have taken medication or drugs, legal or illegal, that could make you sleepy or excessively tired. Or if your baby was premature, born before 37 weeks, or low birth weight, less than 2.5 kilograms. Remember, use a firm, flat, waterproof mattress in a good condition. Never fall asleep with your baby on a sofa or armchair. Keep your baby's head uncovered. Place your baby with their feet to the foot of the cot to prevent wriggling down under the covers. When you check your baby, if they are sweating or their tummy feels hot to the touch, take off some of the bedding. Don't worry if hands or feet feel cold, this is normal. Use lightweight blankets. If your baby feels too warm, reduce the number of layers. Do not use a duvet, quilt or pillow for babies under 12 months. Do not use cot bumpers and toys should be removed. Babies should never sleep with a hot water bottle or electric blanket next to a radiator, heater or fire, or in direct sunshine. Remove hats and extra clothing as soon as you come indoors or enter a warm bus, train or shop, even if it means waking your baby. Do not let your baby get too hot or too cold. Ideally, room temperature should be between 16 and 20 degrees centigrade. For further information, contact www.lullabytrust.org.uk. If your baby is unwell, seek medical advice. Registration must be in person at the register office. By law, the birth must be registered within 6 weeks, 42 days. For more details and to book an appointment, please see the details in the postnatal information pack. You can book appointments online at the gov.uk website.
Until you have registered your baby's birth, you will not be able to claim for your child benefit.
Once you have the birth certificate, it is also important to register your baby at your GP surgery. This will enable them to make an appointment for the 6-week checkup, first vaccinations and following newborn screening. Finance.
Having a new baby can be costly. Many parents buy second-hand items.
If you use a second-hand mattress for your baby's bedding, the second-hand mattress should have been completely protected by a waterproof cover when in use before, have no rips or tears, be in good condition, still be firm and flat. If you use a second-hand car seat that has been used by someone you don't know, you can't be sure whether they've been in a car crash. A crash could make babies' car seats unsafe. Plus, second-hand seats often have missing safety instructions, which makes it hard to know how to fit and use it correctly. Another consideration is that safety improvements are being made all the time. So if the seat is old, you can probably find safer ones on the market. You can find out all about maternity benefits, including maternity leave pay, on the government website. Don't forget to apply for child benefit once you have given birth. You can check if you are eligible to receive this benefit and find out how to claim on the government website. There is also lots of information on the website about other benefits you may be entitled to. If you have not applied for a maternity exemption certificate, you can still apply for this. You're entitled to a maternity exemption certificate if, at the time of your application, you are pregnant or have given birth in the last 12 months. A maternity exemption certificate entitles you to free NHS prescriptions. You can also use the certificate as proof that you are entitled to free NHS dental treatment while you are pregnant. Speak to your midwife, doctor or health visitor and they can complete this with you. The Mid and South Essex Maternity and Neonatal Voices Partnership, MNVP, can also direct you to local services and groups for additional support.
Members of the MNVP include parents, clinicians and people who are interested in maternity services and want to make a positive change to services offered locally.
If you have serious concerns about your health, you can consider all the normal options for emergencies, including calling 999. If you require any help or support, please contact your midwife or triage.
We hope this information has helped and thank you for watching this film.